Ever stared at an ECG strip feeling like you're trying to decode a secret message? That squiggly line holds life or death information, and getting it right is everything. Today, we're diving deep into the most common pitfalls in ECG analysis and how you can avoid them to become a true ECG master. Let's start with the basics: electrode placement. It seems simple, but getting it wrong can be a disaster. Look here, placing V1 and V2 too high can create a pattern that mimics a serious anterior infarct. The correct placement is crucial. See the difference? One is a technical error, the other a life-threatening condition. And what about those messy lines? Artifacts from patient movement or electrical interference can look terrifying, but they're not a heart rhythm. The key is to look for a consistent pattern. Real arrhythmias have a rhythm, even if it's chaotic. Artifacts are just random noise. Now, for the real brain teaser's interpretation, let's focus on the saint segment. Ischemia often shows up as saint depression, like a subtle dip below the baseline. But an acute heart attack, that's typically street elevation, a clear tombstone sign rising above the baseline. Recognizing this difference is critical for rapid intervention. Next up, arrhythmias. Atrial fibrillation, with its irregular rhythm and no clear P waves, is a common one. But then you have ventricular tachycardia, a wide, fast, and dangerous rhythm that demands immediate attention. Knowing the key features for each is non-negotiable. So, how do you pull it all together? Here's the golden rule: never ever interpret an ECG in a vacuum. Always correlate the findings with your patient. What are their symptoms? What's their history? A concerning ECG on an asymptomatic patient might just be a technical glitch, while a subtle change in someone with chest pain could be the only warning sign you get. Mastering ECGs isn't a one-time event, it's a journey of continuous learning. Keep practicing, keep questioning, and always put your patient first. You've got this. Thanks for watching, and don't forget to subscribe for more deep dives into clinical skills.